White House physician Sean Conley and a team of doctors stepped outside Walter Reed Medical Center to discuss President Donald Trump's current state.
He's doing so well, but with the known course of the illness, days 7 to 10, we get really concerned about the inflammatory phase, phase 2.
Dr. Conley would not comment on when the president was infected, but did talk about his symptoms.
He had a little cough, he had the fever. More than anything, he's felt run down. But he did have a fever Thursday into Friday, and since Friday morning, he's had none.
American Henry Giroux, a professor at McMaster University, is skeptical.
They don't provide enough information, they've lied, they've provided misinformation. Why would anybody take them seriously?
In fact, after stating that President Trump was diagnosed with COVID-19 72 hours ago and had begun treatment 48 hours ago, Dr. Conley quickly issued a clarification, saying he was incorrect. He should have said day 3 of diagnosis and day 2 of treatment. He clarified that the president was first diagnosed with COVID-19 on the evening of Thursday, October 1st, and had received an antibody cocktail on Friday.
They issue corrections because they're basically being influenced by political sycophants. I mean, their concern is about the image, not the truth.
The truth of when President Trump contracted the virus is murky. His activity leading up to his diagnosis is not. Last Saturday, he announced his pick for the Supreme Court in a huge gathering at the White House without masks or social distancing.
I put a mask on, when I think I need it.
On Tuesday, Trump and his family went maskless during the presidential debate, even though they wore them backstage at one point. After going maskless in a helicopter, Trump went to Minnesota on Wednesday, where he personally threw objects into a crowd of his supporters. On Thursday, October 1st, everything appeared normal. Trump, who regularly tweets and retweets dozens of times, did so 28 times on Thursday. Everything from his debate performance to New York Governor Andrew Cuomo, a host of other topics, and the last tweet that day, a confirmation that his close aide Hope Hicks, who traveled with him throughout the week, tested positive for COVID-19. Since yesterday, he's only tweeted 5 times, including this video message.
I'm going to Walter Reed Hospital. I think I'm doing very well.
At Walter Reed, he's been given a dose of remdesivir, a COVID-19 therapeutic, as well as an experimental antibody cocktail.
I didn't want to hold anything back. If there was any possibility that it would add value to his care and expedite his return, I wanted to take it.
Dr. Conley's summary of President Trump conflicts with reports from sources close to the president who say that his vitals over the last 24 hours were very concerning and that the next 48 hours will be critical. With the U.S. general election exactly 1 month away, Professor Marvin Ryder at McMaster University expects business as usual for Trump's campaign team.
Well, I suspect, at least for the time being, that if his surrogates go out on the campaign trail, they'll be doing pretty much the same thing that they were doing before.
Professor Giroux says if Trump has a full recovery, it could help strengthen the president's messaging to his base.
He's basically concerned about himself, his career, and his ratings. If he comes out of this, there's nothing that will change.
Now, furthermore, to the U.S. general election, Marvin Ryder says we really need to watch the markets. When Donald Trump confirmed that he was positive for COVID-19, the markets dropped 500 points. It bounced back on Friday, but when he was transferred to Walter Reed Hospital, it dropped another 100 points.